Hello, my name is Dr. Aimee Burch, and I'm an associate professor with Creighton University College of Nursing in Omaha, Nebraska. And I'm presenting on our project called The Impact of the ELNEC Online Curriculum on Undergraduate Nursing Students' Confidence in Providing Palliative Care. You can see the rest of my team, Dr. Julie Goodman, Professor Whitney Vandegraff, Dr. Joanne Genua, and Dr. Mandy Kirkpatrick. They've all been involved in this project. So the problem is that, as we all know, palliative and end-of-life care is essential to nursing in general, and as such is essential to our nursing education process. We do have nursing programs that integrate this type of education, but consistency and quality vary, and the AACN has endorsed the ELNEC online curriculum as it meets the need for consistent, high-quality education for end-of-life. We know that nurses are instrumental to providing holistic, culturally sensitive care to both patients and families, and we help them through that decision-making process preceding death. The work to create these competencies started over 25 years ago, you can see in 1997, and it continues to be edited and revised as new information comes about. So our purpose was to examine how nursing student confidence changed after completing the ELNEC curriculum. So we integrate our ELNEC curriculum throughout our senior level practicum courses, and we do have two different programs that we deal with: our traditional 4-year course, and that is just in Omaha, and our accelerated undergraduate program, which is a 1-year course, and we have campuses in Phoenix and Omaha currently. We did have a campus in Grand Island, Nebraska. So we have that integrated throughout both of those programs in those senior level courses. And we asked our students to complete all 6 modules of the ELNEC online curriculum, and then we had them complete the Primary Palliative Nursing Care Competency Assessment Tool, or the PPNC-CAT. And we were asking them retrospectively to look back and judge their pre-confidence or their confidence level before and after taking that online curriculum. The PPNC-CAT has 9 domains with 33 competency statements, and it uses a Likert scale from not confident to very confident. The graphs in the middle, you can see that we're comparing our 2 programs, both pre and post, and you can see that there was quite a difference, quite an increase in confidence level from pre to post with both programs. So we ran comparative analyses, and it revealed a huge statistically significant positive change in confidence in both programs, p less than 0 basically, and it was roughly equivalent to changing from somewhat confident to confident. Students in both programs rated themselves similarly across most of those subscales, with significant gains again seen in that figure 1 post-ELNEC curriculum. Our post-course confidence ratings, however, our accelerated students rated themselves significantly higher than traditional students when we compare those subscales. For the demographic data that's seen in figure 2, a majority of our students in all of our programs are 25 years or younger, female, predominantly white, and identify about half as either Catholic, Christian, or spiritual or other religion. When we look at our domain scores, our lowest domain score pre-course was education. Post-course was that care nearing end of life. Highest domain score pre-course was communication, and we do stress communication throughout our nursing programs. Post-course, our high domain score was self-care and reflection, and that is another area that we stress heavily throughout both programs. The largest domain percent change was our education subscale, almost a 50% increase in confidence with that. Smallest percent change was that communication subscale. So what are the implications from this? We know that the ELNEC curriculum positively impacts the student's self-perceived skill and confidence in end-of-life care. We do see that there could be further reinforcement through interactive and experiential learning supports, like SIMS and ensuring that clinicals are done in those areas where they might see those patients. There are opportunities to stress patient education earlier in our nursing programs and focusing on patient care when they're nearing that end of life. Additionally, we might want to consider how this programming can be leveraged to promote palliative care competency among nursing professionals out in the community. So maybe bringing that into our nurse residency courses with our community partners, ensuring that nurses that we work with in the community have access to that as well. Additionally, we'd like to say a special thanks to Dr. Jack Taylor and our Creighton University's Biostatistical Core for all of the statistics for this study. Thank you.